Welcome to this audio PowerPoint presentation on basic ocular anatomy and physiology for 3rd and 4th year medical students. This was developed at the Tennant Institute of Ophthalmology by Dr. Daniel McGowan under Dr. Ramesh. The 3 main topics covered are the eyeball, the extraocular muscles, and accessory eye structures. The conjunctiva is a thin mucous membrane that lines the eyelids and the anterior surface of the eyeball. The conjunctival epithelium is continuous with the epidermis of the skin and the lid margin and the corneal epithelium at the limbus. The attachment of the conjunctiva to the underlying tissue is rather loose, allowing easy movement of the globe. The conjunctiva can be divided into 3 regions: the palpebral conjunctiva, the conjunctival fornices, and the bulbular conjunctiva. The palpebral conjunctiva lines the eyelids. It is firmly attached to the posterior surface of the tarsal plates. Conjunctival fornices, the conjunctiva of the superior and inferior fornices, forms the transitional regions between the palpebral and the bulbular conjunctivae. Bulbular conjunctiva. This portion lies in contact with the eyeball. It is loosely attached by connective tissue to the sclera and fascia bulbi, covering the tendons of the recti muscles. The line along which the fusion of the conjunctiva to the cornea occurs is called the conjunctival limbus. This is situated about 1 mm anterior to the edge of the limbus of the cornea. The conjunctiva can be split into 2 layers: superficial epithelium. Palpebral conjunctiva is stratified squamous epithelium. Bulbular conjunctiva is stratified columnar epithelium, and the limbus is stratified squamous epithelium. Conjunctival submucosa consists of fine, delicate connective tissue. In its superficial part are large collections of lymphocytes. The deeper part of the submucosa contains denser fibrous tissue and the blood vessels, nerves, smooth muscle, and accessory lacrimal glands. The transparent cornea forms the anterior 1/6 of the eyeball. It acts as a physical barrier to infection and injury. The cornea is the main structure responsible for the refraction of light entering the eye. The cornea is avascular and devoid of lymphatic drainage. It gets its nerve supply from the ophthalmic division of the trigeminal nerve. 5 layers of the cornea: the epithelium, Bowman's membrane, substantia propria, desmomes membrane, and the endothelium. The limbus is where the edge of the cornea joins the sclera. It is an area measuring about 1.5 to 2 mm wide, which is 1 mm posterior to the conjunctival limbus. Stem cells are contained in the limbus epithelium, which enables regeneration of the corneal epithelial cells. The sclera forms the posterior 5/6 of the eyeball and is opaque. The sclera may be divided into 3 layers: episclera, scleral stroma, and lamina fusca. The sclera is relatively avascular structure. Functions: protection from trauma, preserves shape of the eyeball, and provides a rigid insertion for the extraocular muscles. Tears are secreted by the lacrimal gland. The tear film is composed of 3 layers: lipid layer, which inhibits evaporation of the underlying watery layer; watery layer, containing the lysosome, immunoglobulin, and beta-lysin, and is the defense against the invading organisms; mucin layer, wets the microvilli of the corneal epithelium. Function of tears: acts as a source of oxygen to the cornea, antibacterial action, removes debris, pathway for white blood cells and growth factors. The iris is a thin, contractile, pigmented diaphragm with a central aperture, the pupil. It is suspended in the aqueous humor behind the cornea and the lens. Its function is to control the amount of light entering the eye and impinging on the retina by dilating or constricting the pupil. The color of the iris is produced by the pigment in the melanocytes. The blue iris has less pigment in the melanocytes compared with the brown iris. The iris consists of two layers, the stroma and the epithelial layer. The stroma consists of highly vascular connective tissue. It also contains nerve fibers, smooth muscle of the sphincter pupillae, and the myoepithelial cells of the dilator pupillae. The epithelial layer: two layers, anterior and posterior. Anterior layer lies in contact with the stroma of the iris. The posterior layer is bathed with aqueous humor and faces the posterior chamber. The blood supply of the iris is provided by the radial vessels in the iris stroma. These arise from the major arterial circle in the stroma of the ciliary body. The major arterial circle is formed by 2 long posterior ciliary arteries and 7 anterior ciliary arteries. From the major arterial circle, branches are given off which converge towards the pupil. At a short distance from the border of the sphincter muscle, they divide and anastomose to form the minor arterial circle. From this minor arterial circle, branches continue their course to the pupillary border. Parasympathetic: ciliary muscles and sphincter pupillae are supplied by the short ciliary nerves, a branch of the ocular motor nerve. Sympathetic: the dilator pupillae are supplied by the long ciliary nerves, which are branches of the nasociliary branch of the ophthalmic division of the trigeminal nerve. Miosis: the sphincter pupillae constricts the pupil in bright light and during accommodation. This occurs in response to parasympathetic nerve activity. Mydriasis: the dilator pupillae dilates the pupil in low-intensity light and during excitement or fear. This occurs in response to sympathetic nerve activity. The ciliary body is continuous anteriorly with the iris and posteriorly with the choroid. The anterior surface is ridged and known as the pars plicata. It is this that surrounds the periphery of the iris and gives rise to the ciliary processes. The posterior surface is smooth and flat and known as the pars plana. Functions: suspension of lens, involved in accommodation of light, produces aqueous humor. Made up of the ciliary epithelium, ciliary stroma, and ciliary muscle. Ciliary epithelium: bilayered cuboidal epithelium. The innermost layer is the non-pigmented epithelial cell layer that is apically joined with the pigmented epithelial cell layer. Ciliary stroma consists of bundles of loose connective tissue, rich in blood vessels and melanocytes, containing embedded ciliary muscle. Ciliary muscle forms the bulk of the substance of the ciliary body and consists of smooth muscle fibers, divided into longitudinal, oblique, and circular groups. Blood supply: 2 long posterior ciliary arteries and 7 anterior ciliary arteries. The ciliary muscle is innervated by parasympathetic fibers from the ocular motor nerve. The nerve fibers reach the muscle via the short ciliary nerves. It is the contraction of the ciliary muscle, especially the longitudinal and circular fibers, that pulls the ciliary body forward in accommodation. The choroid is a thin, soft, brown coat lining the inner surface of the sclera. Principal function is to nourish with its blood vessels the outer layers of the retina. Made up of 3 layers: the vessel layer, the capillary layer, Bruch's membrane. Blood supply: anterior, long, and short ciliary arteries, branches of the ophthalmic artery. Nerve supply: long and short ciliary nerves from the trigeminal nerve. Bruch's membrane, made up of 5 different components. 1. Basement membrane of the capillary endothelium. 2. Collagen layer, outer. 3. Elastic layer. 4. Collagen layer, inner. 5. Inner basement membrane of the pigmented epithelium of the retina. It is 2 to 4 micromillimeters thick. Thickest posteriorly near the optic disc. Retinal pigmented epithelium transports metabolic waste across Bruch's membrane to the choroid. The aqueous humour is a clear fluid that fills the anterior and posterior chambers of the eyeball. It contains glucose, amino acids, and high concentrations of absorbic acid. It also contains dissolved gases. Function: supplies the metabolic needs of the avascular lens and cornea, maintains interocular pressure, therefore supporting the wall of the eyeball and maintaining its optical shape. The aqueous humour is formed by the ciliary processes of the ciliary body in the posterior chamber. This occurs mainly as a result of active transport by the non-pigmented cells of the ciliary epithelia, requiring energy in the form of adenosine triphosphate. The aqueous flows between the suspensory ligaments of the lens and then through the pupil into the anterior chamber. Around 90% of the outflow takes place through the trabecular network. The remaining 10% takes place by uvulosclera outflow. The lens is a transparent, biconvex structure situated behind the iris and the pupil and in front of the vitreous body. Functions: alters the refractive index of light entering the eye and focuses this onto the retina. Blocks UV light which can harm the retina. Centre points on its anterior and posterior surfaces are referred to as the anterior and posterior poles. Made up of 3 parts: an elastic capsule, lens epithelium, which is confined to the anterior surface of the lens, and lens fibers. The lens is held in position by a series of delicately radically arranged fibers known as a suspensory ligament of the lens, or zonule, which arise from epithelium of the ciliary processes. To accommodate the eye for close objects, the ciliary muscle contracts, relieving tension on the suspensory ligament of the lens, which allows the lens to assume a more globular shape. The lens is metabolically active and requires nourishment in order to maintain growth and transparency. Glucose is the main source of energy, around 80% of which is metabolized via anaerobic metabolism. Main protein building blocks of the lens are crystallins, which are produced by the lens fiber cells and help increase the refractive index of the lens. The eyelids. The eyelids are thin curtains of skin, muscles, fibrous tissue, and mucous membranes that serve to protect the eye from injury and excessive light, and also to distribute tears over the ocular surface during blinking. Each lid is seen to be divided into an orbit and tarsal portions by a horizontal, palpable sulcus. The upper and lower lids meet at the medial and lateral angles and are separated from one another by the palpable fissure. The medial angle is separated from the eye by a triangular zone, the lacus lacrimalis, in which a small raised red swelling, the carbuncula lacrimalis. Notable features on lid margins: lacrimal puncta, openings of the tarsal glands, skin, conjunctival transition zone, the grey line. Lacrimal puncta, located at the medial ends of the upper and lower lids. These drain tears from the lacus lacrimalis, opening of the tarsal glands visible to the naked eye as a row of minute openings. Skin conjunctival transition zone occurs at the level of the opening of the tarsal glands. Conjunctiva becomes continuous with the keratinized skin epithelium. The grey line marks the anterior boundary of the tarsal plate and is a useful landmark for surgical incisions. The layers of the eyelid. Again, another picture showing the layers of the eyelids. From superficial to deep, each lid consists of skin, subcutaneous tissue, striated muscle fibers of the orbicularis oculi, orbital septum, and tarsal plates, smooth muscle and conjunctiva. Blood supply. Lateral and medial palpable arteries. Lateral palpable arteries are derived from the lacrimal artery, which is a branch of the ophthalmic artery. Medial palpable arteries are derived from the ophthalmic artery. Orbicularis oculi is a broad, flat, striated muscle with orbital, palpable, and ciliary portions, supplied by the temporal and zygomatic branches of the facial nerve. Acts like a purse string, drawing the skin of the forehead, temple, cheek, and orbital margin towards the medial angle of the orbit, firmly closing the lids. The upper lid, distinct from the lower lid, contains the insertion of a powerful striated muscle, the levator papillary superioris, which raises the upper lid. The retina is the internal layer of the eyeball, where the optical image is formed by the eye's optical system. It is here that chemical transduction occurs, so that nerve impulses are created and transmitted along visual pathways to the brain for higher cortical processing. The retina is a thin, transparent membrane having a purplish-red colour. Consists of two layers, an outer pigmented layer, retinal pigmented epithelium, and an inner neurosensory retina. However, based on light microscopic findings, the whole retina is composed of 10 layers. These are, from outside inwards, as follows. 1. The pigmented epithelium. 2. The rods and cones. 3. The external limiting membrane. 4. The outer nuclear layer. 5. The outer plexiform layer. 6. The inner nuclear layer. 7. The inner plexiform layer. 8. The ganglion cells. 9. The nerve fibre layer. 10. The internal limiting membrane. Dr. Ian Livingston has kindly supplied excellent pictures of the retina which have been obtained using the new prototype smartphone ophthalmoscopes. 2 diagrams detailing the anatomy of the retina. Posterior pole or central retina is a 5 to 6 millimeter diameter circular zone of retina situated between the superior and inferior temporal arteries. Macula lutea, a 1.5 millimeter diameter area in the posterior pole around 3 millimeters lateral to the optic disc. It is partially yellow in colour, and it is the retinal area for most distinct vision. Fovea centralis, a central 0.35 millimeter wide zone in the macula. It is where cone photoreceptors are concentrated at maximum density to the exclusion of rods. The optic disc lies 3 millimeters medial to the centre of the macula, complete absence of rods and cones, thus referred to as the blind spot. Slightly depressed at its centre, where it is pierced by the central retinal artery and vein. It has a pale pinkish whitish colour. Peripheral retina, the remainder of the retina outside the posterior pole. Ora serrata, the dentate anterior margin of the neurosensory retina. At this transition zone, the neuroretina is continuous with the columnar non-pigmented epithelial cells of the pars plana. There are 2 types of photoreceptors, rods and cones. Rods, mainly responsible for vision in dim light and produce images consisting of varying shades of black and white, are absent at the fovea, rising rapidly in numbers towards the periphery and then slowly diminishing at the extreme periphery of the retina. Cones are adapted to bright light and can resolve the fine detail and colour vision, are most dense at the fovea and decrease in numbers at the periphery. The blood supply from the retina is from 2 sources. The outer retina is supplied by the choroidal capillaries. The inner retina is supplied by the central retinal artery. Retinal blood vessels maintain the blood-retinal barrier as the endothelium is non-fenestrated. In around 20% of the population, a connection between the 2 arterial systems exists, the cilio-retinal artery. The vitreous body fills the eyeball behind the lens. It occupies about 4/5 of the eyeball and lies between the lens and the retina. It is a colourless, transparent gel consisting of 98% water. It also contains hyaluronic acid, amino acids, soluble proteins, salts, and ascorbic acid. Functions: transmits light and contributes slightly to the dioptric power of the eye, supports the posterior surface of the lens, and assists in holding the neural part of the retina against the pigmented part of the retina. Anteriorly, the vitreous has a saucer-shaped depression for the lens, called the hyaloid fossa. The vitreous is a transparent gel having a more dense cortex and a more liquid centre. Cortex is attached at several points around its circumference. Neural part of the retina. Behind the lens. Periphery of the hyaloid fossa. Vitreous base. Attachment of the vitreous at region of the pars plana of the ciliary body. Hyaloid canal is a narrow channel which runs forward from the optic disc to the posterior pole of the lens. During fetal life, it contains the hyaloid artery, a branch of the central artery of the retina, which nourishes the lens. The hyaloid artery disappears 6 weeks before birth, and the canal becomes filled with liquid. The orbital cavity. The orbital cavities are a pair of large bony sockets that contain the eyeballs, their associated muscles, nerves, vessels, and fat, and most of the lacrimal apparatus. Each cavity is roughly the shape of a quadrilateral pyramid, whose base is the orbital margin and whose apex is the optic channel. Made up of 7 individual bones: maxilla, frontal, sphenoid, zygomatic, palatine, ethmoid, and lacrimal. The walls of the orbital cavity are lined with periosteum and consist of a roof, a floor, and a lateral and medial wall. Orbital margin is a thickened rim of bone which helps protect the orbital components. It's made up of the frontal, zygomatic, and maxilla bones. Function: accommodates and protects the eye and adnexa, and serves to transmit the nerves and vessels that supply the face around the orbit. Formed by the orbital plate of the frontal bone and lesser wing of the sphenoid. The roof of the orbit is thin and fragile, separating the orbital cavity from the anterior cranial fossa and the frontal lobe of the cerebral hemisphere. Features: anterolaterally there is a slight depression, the lacrimal fossa, for the orbital part of the lacrimal gland. Anteromedially there is a small depression, trochlear fossa, for the pulley of the superior oblique muscle. Formed by the orbital plate of the maxilla, orbital surface of the zygomatic, orbital process of the palatine. Orbital plate of the maxilla separates the orbital cavity from the maxillary sinus. The floor is continuous with the lateral wall anteriorly, but is separated from it posteriorly by the inferior orbital fissure. Running forward from the fissure is the infraorbital groove. At the midpoint of the floor, the infraorbital groove becomes the infraorbital canal, which opens into the face as the infraorbital foramen. Formed by the zygomatic and greater wing of the sphenoid. It is the thickest wall. Zygomatic bone separates orbit from the temporal fossa. Greater wing of the sphenoid separates the orbit from the temporal lobe of the brain in the middle cranial fossa. The lateral wall and roof are continuous anteriorly, but they are separated posteriorly by the superior orbital fissure, which communicates with the middle cranial fossa. Formed by the frontal process of maxilla, lacrimal bone, orbital plate of the ethmoid, and body of the sphenoid. Thinnest of the walls. Lacrimal fossa for the lacrimal sac, bound by anterior and posterior lacrimal crests, and is continuous below with the nasolacrimal canal, which leads into the nasal cavity. Lacrimal apparatus consists of the lacrimal gland, which secretes tears, the lacrimal lake, the lacrimal caniculi, the lacrimal sac, and the nasal lacrimal duct, which carries tears into the nasal cavity. Lacrimal gland consists of a large orbital part and a small palpable part, which are continuous with each other around the lateral edge of the aponeurosis of the levator papilla superioris. Lobulated tubular acinar structure. Blood supply via the lacrimal artery, which is a branch of the ophthalmic artery. Approximately 12 ducts of the gland pass from the orbital part through the palpable part to open into the superior conjunctiva fornix. The lacrimal gland receives autonomic and sensory fibers. The sensory fibers reach the lacrimal gland and the lacrimal nerve, a branch of the ophthalmic division of the trigeminal nerve. The paranasal sinuses comprise the frontal, ethmoid, sphenoid, and maxillary sinuses. They are air-filled cavities in the skull that are in communication with the nasal cavity via a series of apertures, lined by pseudostratified columnar epithelium. Drainage: maxillary sinus, middle meatus through the hiatus semilunaris, frontal sinus, middle meatus via frontal nasal duct, sphenoid sinus, sphenoid-ethmoid recess. Ethmoidal, anterior group, middle meatus, middle group, middle meatus, posterior group, superior meatus. Ethmoidal sinusitis is the most common cause of orbital cellulitis. There are 6 true extraocular muscles responsible for the movement of the globe. The true extraocular muscles comprise 4 rectus muscles, which arise from the tendinous ring at the apex of the orbit and insert into the sclera about 4 to 8 millimeters behind the limbus, and 2 oblique muscles, whose tendons approach the globe from the front and insert into the posterior aspect of the sclera. Superior oblique origin, superior medial to the optic canal. Inferior oblique origin, floor of orbit, just posterior to orbital margin, and lateral to nasolacrimal canal. Superior rectus, innervated by the superior division of the ocular motor nerve. Inferior rectus, innervated by the inferior division of the ocular motor nerve. Lateral rectus, innervated by the abducent nerve. Medial rectus, innervated by the inferior division of the ocular motor nerve. Superior oblique is innervated by the trochlear nerve. Inferior oblique is innervated by the inferior division of the ocular motor nerve. Memory aid. LR6, SO4 in brackets 3, meaning lateral rectus innervated by cranial nerve 6, superior oblique innervated by cranial nerve 4, and all others innervated by cranial nerve 3. Extraocular muscles involved in movements of the eye, as per diagram. The retina, the optic nerve, the optic chiasma, the optic tracts, the lateral geniculate bodies, the optic radiations, and the visual cortical areas make up the visual pathway. Lesions of the visual pathway may have many pathological causes. Expanding tumours of the brain and neighbouring structures such as the pituitary and meninges, and cerebrovascular accidents are commonly responsible. Complete section of one optic nerve produces total blindness of that eye. The pupil will not react to light directly, but does so consensually. The sight in the other eye is normal. The pupil reacts to light directly, but not consensually. Causes: central retinal artery occlusion, retrobulbar neuritis, optic nerve tumours. Sagittal section of the optic chiasma will produce bitemporal hemianopia. The pupils react normally to the direct light reflex, the consensual light reflex, and accommodation reflex, provided the light falls on the temporal retinae. Can be caused by pituitary enlargement. Lateral section of the optic chiasma on one side produces nasal hemianopia. Division of the optic tract on one side will result in contralateral homonymous hemianopia. The pupils will react normally to the direct light reflex, the consensual light reflex, and the accommodation reflex, provided that light falls on the seeing part of the retina. Destruction of the lateral geniculate body produces contralateral homonymous hemianopia. Again, the pupils will react normally to the direct light reflex, the consensual light reflex, and the accommodation reflex, provided that the light falls on the seeing part of the retina. Destruction of the optic radiation produces contralateral homonymous hemianopia. Here again, the pupils react normally to reflex stimulation. Finally, destruction of the primary visual cortex produces contralateral homonymous hemianopia, and the pupils react normally to reflex stimulation. The ocular motor nerve is the largest of the extraocular nerves and supplies all the extraocular muscles, except the lateral rectus and superior oblique. Component: general somatic afferent and general somatic efferent fibers. Function: raises upper eyelid, turns eyeball upward, downward, and medially, constricts pupil, and accommodates eye. Opening in skull, superior orbital fissure. The trochlear nerve is the most slender of the cranial nerves and is the only somatic efferent nerve to emerge from the posterior aspect of the central nervous system. Component: general somatic efferent fibers. Function: assists in turning the eyeball downwards and laterally. Opening in the skull, superior orbital fissure. The abducent nerve is a small nerve that supplies the lateral rectus muscle of the eyeball. It is the only nerve to lie in the dural wall of the cavernous sinus. Component: general somatic efferent fibers. Function: lateral rectus muscle turns eyeball laterally. Opening in skull, superior orbital fissure. The trigeminal nerve is the largest cranial nerve. It can be divided into 3 divisions: ophthalmic division, maxillary division, and mandibular division. Component of the ophthalmic division: general somatic afferent fibers. Function: sensation of cornea, skin of forehead, scalp, eyelids and nose, and also mucous membrane of paranasal sinuses and nasal cavity. Opening in skull, superior orbital fissure. That is the end of this audio PowerPoint presentation on basic ocular anatomy and physiology for 3rd and 4th year medical students. Thank you for listening.